Oral health is an integral component to overall health. And nowhere is this more important than in a long-term care setting, where residents have widely varying abilities to care for themselves, and where many of the residents have some degree of dementia. Oral care for long-term care residents should be provided at least twice daily. Yet caregivers sometimes have difficulty carrying out this essential level of care. Caregiver difficulties usually stem from one or more of the following factors: difficulty managing responsive behaviors, fear of being bitten, shortage of time, not having the right oral care supplies, health and safety issues, and lack of confidence that they can do the job. This video is a tool to help caregivers in long-term care settings overcome some of these barriers to providing oral care. Poor oral health can have serious consequences for anyone. It can lead to severe health problems, and it can also limit the ability to socialize, leading to isolation and depression. Recent studies have linked gum disease with a variety of serious health concerns, including heart disease and stroke, as well as diabetes. Oral bacteria is also a key factor in aspiration pneumonias, especially with individuals that have swallowing problems. Pneumonia is the second most common infection in long-term care, and statistics show that 20 to 50% of affected residents will die because of the infection.
Years since June has been to the dentist. And do you notice if her dentures, are they causing her any pain, any discomfort? Does she seem agitated at all by them?
In order to identify oral health problems at an early stage, each resident in a long-term care setting should have an initial oral assessment provided by nursing staff upon admission. This assessment should be repeated quarterly, or sooner if there is a change in health status. Daily oral care plans should also be prepared on admission and updated at least quarterly.
That's great.
Residents with dementia should have all necessary dental treatment completed in the early stage of the disease, as this becomes increasingly difficult as the dementia advances. And for the basic daily oral care for residents with dementia, special strategies can be employed depending on whether the dementia is in the early, mid, or late stages.
Do you know how to brush your teeth? Okay, do you have your own toothbrush? Your own toothpaste? Okay, is there a particular brand of toothpaste that you use?
In the early stages of dementia, caregivers need to assess the ability of the resident to do their own self-care, and always encourage the resident to do their oral care themselves. Caregivers must also be able to recognize the signs of impending trouble or agitation. For example, opening and closing cabinets or drawers, or getting out a toothbrush and applying toothpaste may trigger responsive behavior, so supplies should be assembled first.
We're going to go to the bathroom, okay? You brush your teeth.
Oral care should be provided in or near the bathroom, but mirrors can be frightening to a person with dementia. If the mirror seems to be a distraction, covering the mirror may help with this problem. Oral care items should be identified with the resident's name in order to prevent cross-contamination between residents. A pea-sized amount of fluoridated toothpaste is normally placed on the toothbrush. Toothpaste should not be used, however, for anyone with swallowing problems. A large-handled toothbrush with a small head and soft bristles works best. The brush should be replaced when bristles are frayed and after the resident has had any illness or infection.
Ruth?
Yeah.
Can you brush your teeth?
Yes, I can do it.
Okay. All right, go ahead. Brush your teeth.
Let the resident know what you are planning to do.
Good.
and use positive words and encouraging statements.
You know how to brush your...
Ask them to show you how they brush their teeth. Cue or coach them continually during oral care.
Very good. You're doing an excellent job.
You can try using a hand-over-hand technique or doing the brushing by yourself if they will allow it. Gloves need not be used unless there is a possibility of an infection present. A variety of devices are available to help clean difficult-to-reach areas of the mouth. Ask an oral health professional for more information.
Now hold on to the toothbrush.
It is important to encourage the resident to do as much of their self-care as possible. Never assume that just because they have dementia, you need to do their oral care for them. Making oral care a part of their daily routine will help make it less fearful for them. In mid-stages of dementia, some form of assistance with daily care is usually required. At this stage, many are still able to do their own care, but require more time and cueing. Try to do oral care in the bathroom if at all possible, as the sink, water, counter, and toiletries also serve as cues. Prepare your supplies and know ahead of time whether or not you will use toothpaste. If there is a swallowing problem with the foam produced by toothpaste, use only a moistened toothbrush.
Excuse me, Dirk? Dirk.
Leave me alone.
Never awaken a resident for oral care, as this may cause agitation.
Okay, I'm sorry to wake you. I'll come back later. Hi, Dirk. Dirk, I have to brush your teeth.
Doing oral care at a better time and with a positive approach will make things much easier for both the resident and you.
Okay.
When working with someone in a wheelchair, pay attention to your body positioning.
You open up your mouth.
Stand to the side and slightly behind the person if you are providing care.
It's gonna brush your teeth.
To avoid being bitten, fingers should be placed only inside lips or cheeks.
Instead of my finger.
The two-toothbrush technique is preferred for residents that have a difficult time keeping their mouth open or who tend to bite down. Remember to coach and cue the whole time.
Leave me alone.
If the resident begins to grab or clutch, try placing a rolled-up washcloth in each hand. If they continue to grab, explain what you are doing, slowly, softly, calmly, and reassuringly. If the resident appears to be becoming more agitated, have your care partner assist you by holding the resident's hands and continuing to speak calmly to them. Only one person should speak to avoid confusion. If the resident's agitation continues to increase, leave the room and come back a little later to try again.
You're doing so well. Thank you so much for letting us do this.
I'm going to take your dentures out, Patricia.
Residents with full or partial dentures should have their dentures removed and cleaned at least twice each day.
Is that okay?
A regular toothbrush is still used to clean the palate, tongue, cheeks, and ridges of the mouth. Carefully bring the dentures into the bathroom. Then, place a piece of paper towel or a clean face cloth in the bottom of the sink and add some cool water. Should the denture drop, it will be cushioned and less likely to break. Dentures should be scrubbed with a denture brush and denture paste using cool water. A regular toothbrush is too soft and too small to properly clean dentures. Remember that plaque is sticky and adheres just as tightly to dentures as to natural teeth, so it must be scrubbed off. Simply soaking with a denture tablet will not remove plaque. Plus, it's best to avoid these tablets with residents with dementia. At bedtime, dentures should be placed in a container of cool water and left overnight. If the resident prefers to wear his or her dentures at night, then they should be left out of the mouth for at least 2 to 3 hours during the day to give tissues a chance to rest. Dentures should be labeled with the wearer's name. Professional labeling is best and can be done by a dentist or denturist, and there are also kits available to help nursing staff do this.
Here we go.
In the late stages of dementia, many residents can still participate in their own care and should be encouraged to do as much as they can. Some residents at this stage, however, may be totally dependent on you to do their care.
Would you like to try a little bit more?
It is best to provide care when the resident is up, unless they are more settled in bed. The best time is right after a meal, as most residents are not agitated when they are being fed.
And now we'll look after your oral care.
If care is delivered while a resident is in bed, ensure that the bed is rolled up and that the bed rail is in position. Oral tissues at this stage are often dry with thick, heavy mucus secretions that make mouth care difficult. A water-based gel should be used to moisten tissues. Often food is pouched inside the cheek and must be removed gently with a moist cloth wrapped around your
A
finger.
little bit of that lunch there, you're saving up there. I'm just going to clean that out for you. We're going to just give yourself a nice cleaning.
Any remaining teeth and mouth tissues should be cleaned gently with a soft, moistened toothbrush.
Oh, you're doing a good job.
No toothpaste is used, as swallowing problems are common at this stage.
Now, Lane, can you just open up and stick your tongue out for me?
The mouth should be assessed daily. Fungal and other infections become more common in residents who have multiple health problems. Any signs of infection should be reported immediately. If an infection is suspected, toothbrushes and other oral care devices that come in contact with oral tissues should be discarded and replaced by new ones. Oral care is an important daily task to prevent against infection in the mouth and from further harm to general health. At times, providing oral care can be difficult and requires innovative strategies, patience, and persistence to be successful. This short video addressed a variety of issues to help caregivers provide oral care. Dealing with responsive behaviors when providing oral care is similar to dealing with these behaviors during other aspects of personal care. It's important to know the resident, their behaviors, what triggers their behaviors, and how best to respond to their behaviors. The fear of being bitten can be overcome using proper finger placement, the two-toothbrush approach, and, when necessary, having two caregivers attend the resident. Determining the optimal time to provide oral care and using the techniques demonstrated will decrease the time required for oral care. If the basic supplies provided by the long-term care home are not sufficient, local dental organizations, families, and charity clubs can be approached to assist in the purchase of additional oral care supplies. Paying attention to body mechanics is critical to ensure your own back safety. And the more successful you are in all of the above areas, the more your confidence will grow. Remember to immediately report any behavioral changes, mouth sores, teeth that move, excessive bad breath, or mouth odor. If you find that it is becoming increasingly difficult to complete the resident's oral care, document this on the resident's chart. It may then be time to reevaluate their oral care plan and determine new strategies that may need to be implemented to assure that the resident's oral care gets done. As with other aspects of personal care, there will always be times when you are challenged. Above all, you are the voice for your resident. Speak up and seek assistance by contacting your psychogeriatric resource consultant when needed. Oral care must not be left undone. Your resident's health depends on your encouragement, your skill, and your support.